In this video, we'll discuss about aneurysm. Aneurysm is an permanent abnormal focal dilation of a blood vessels or heart occurring due to congenital or acquired weakening or destruction of the vessel wall. So, wall of artery, this one is the normal. So wall of artery protrude out. So wall of artery here protrude out. This area of here we know three layer is presented: tunica edema, tunica media, tunica advertia. Three layer is presented or weakening. This particular layer weakening. It is forming a pouch. It is known as aneurysm. So wall of artery protruded. After that, it forming a pouch. It is known as aneurysm. Suppose this one is the normal artery and that wall of artery, this portion weak due to various reasons. So this portion will protrude out like this. The focal dilation of that portion of artery because of that weakening of the wall is known as aneurysm. The reason for weakening can be various reasons, so which can leads to different type of aneurysm. What are the clinical features of aneurysm? It found in inside blood vessels. Does we have any problem? This one is the normal blood flow. Because of aneurysm, blood will go here. Blood will go and do stasis. Stasis here. Stasis blood will lead to form thrombosis. So because of stasis, it form thrombosis, thrombus formation. Thrombus only detached. So leads to formation of embolism. So it is called as first is stasis, then thrombosis, then embolism. Flowing thrombus is called as embolism. That is altered blood flow. Because of altered blood flow only, stasis, thrombosis, then embolism. It can be ruptured. Sometimes it can be ruptured. Most commonly it occurs in deep vein of the legs. So first one is alteration in the flow of blood. Alteration happen after this thrombosis. Third one is thromboembolism. Next, sometimes that aneurysm is ruptured. Blood will come out. That one. The fourth one is rupture of vessels. After that, compression will be there. So compression of neighboring structure. Say for example, here this one is the nerves. Here compression, that it will affected that nerves. So compression will happen. So these are the 5 clinical features of aneurysm: alteration of flow of blood, thrombosis, thromboembolism, rupture of vessels, then compressions of neighboring structure. After that, classification of aneurysm. Aneurysm can be classified into 3 categories. First one is depending upon that composition of that wall. Second one is depending upon that shape. Third one is based on the pathogenetic mechanism. First one is depending upon that composition of that wall. First one is depending upon that composition of that wall. Artery having 3 wall. Inner one tunica edema, middle one tunica media, outer one tunica adventria. Aneurysm are 2 types. Here 3 layer presented. If aneurysm all 3 layer, these all 3 layer protrude out. All 3 layers protrude out. This is called as true aneurysm. It is called as true aneurysm. Here opposite side, here there is a hole. Here hole or gap, penetration, blood will come out. So here by using this hole, blood will come out. Body having connective tissue. So body having connective tissue. It look like a aneurysm but not actual aneurysm. It is hematoma. Here the wall is made up of connective tissue, so blood is present inside it. This is hematoma. It is known as false or pseudo aneurysm. So false aneurysm means here connective tissue. Here the 3 layer. False or pseudo aneurysm, it is an hematoma, not aneurysm, having hematoma in fibrous wall. As a result, drama. Blood wall is ruptured and blood is collected, that is lined by connective tissue. That is based on the composition of wall. Wall containing 3 layer name is called as true aneurysm. Wall containing connective tissue name is called as false or pseudo aneurysm. Second classification based on the shape, 5 different type of shape available. First one is circular, second one is fusiform, third one is cylindrical, fourth one is serpentine, fifth one is Aneurysms. So these are the different shape of, based on the shape it have 5 type of aneurysm: circular, fusiform, cylindrical, serpentine and Aneurysms. So third one is mycotic aneurysm. It can be due to any microorganism. It can be bacteria or virus or fungi or protozoa entering blood wall and causes inflammation. It will weaken this part, after that it will causes aneurysm. So these are the 3 important type of aneurysm. First one is atherosclerotic aneurysm, syphilitic aneurysm, then mycotic aneurysm. First one is because of atherosclerosis, majority 90%. Second one is because of Treponema pallidum. Third one is because of microorganism. The most common aortic aneurysm, most commonly seen in male. Most common site, aorta. Suppose this is heart, it having 4 chamber from left ventricular. The aorta will arises and coming out. This portion is ascending aorta. This portion is arch of aorta. This one is descending aorta. Descending aorta divided into 2 portions. Above the diaphragm, this one is the diaphragm. Above the diaphragm, thoracic aorta, and below the diaphragm, abdominal aorta. So this is the 2 type of location. Then this abdominal aorta having renal artery for 2 kidney. It having two portion. This one name is called as suprarenal. This one name is called as infrarenal. So this is the master diagram. By using we will draw different type of aneurysm. So ascending aorta, arch portion, descending aorta. It having this one is that diaphragm. Above diaphragm, thoracic aorta, below diaphragm, abdominal aorta. After that, that abdominal aorta have renal artery to kidney. Here it having two portions, suprarenal and infrarenal. So first one is atherosclerotic type. Where it is present? Here it is present. First one is here it is present. It is presented in abdominal aorta. Extra location, correct location, infrarenal part of abdominal aorta in descending aorta. Then syphilic. This one is ascending. This part ascending, just arrival of aorta from aortic valve. Aneurysm will causes dilatation of valve and it will leads to this part, aortic regurgitation, aortic regurgitation, AR. Then third one is mycotic, suprarenal part. It will affected that suprarenal part having aneurysm. So three types. Here atherosclerotic, here syphilic, this one is mycotic. Atherosclerotic aneurysm causing destruction of medial elastic tissue. That's why it leads to weakening of that wall. It leads to aneurysm. Then pathogenesis of atherosclerotic aneurysm, atherosclerotic lesion. This one thinning and destruction of medial elastic tissue. After that atrophy and weakening of that wall, then it causes to atherosclerotic aneurysm. Next, syphilic aneurysm. It occur only 10% of cases. In tertiary stage it is happening. It is common in male after 50 years old. What is the site? It is ascending near to aortic ring, causing aortic incompetence. This one mostly scarular in shape. It is caused by Treponema pallidum. Pathogenesis in tertiary syphilis, Treponema pallidum affect tunica adventitia. In vasa vasorum. What is vasa vasorum? Blood vessel for the blood vessels. Treponema pallidum affect vasa vasorum. It is called end arteries obliterans. End arteries obliterans. Blood vessels is obstructed. Blood vessels not get blood. It will leads to ischemia injury. So destruction of smooth muscle cells. It become weakening of that wall, leads to syphilitic aneurysm. Finally, treatment for aneurysm. How we diagnose is CT scan. Asymptomatic for finding other disease. Incidental finding of aneurysm. So how will give treatment? If rupture, risk rupture means surgical only, correct. Rupture means emergency condition. What is the risk of rupture? You can see the diameter. You can see the diameter of aneurysm. Less than 4 centimeter or less, no risk. Don't operate, wait and watch. Then 1% out of 100 patient, 1 ruptured, 99 not ruptured. Then 11%, 89 people not ruptured, only 11 ruptured. Then 25%, 25% died, 75% survive. So every year it increasing in size 0.2 to 0.3 per year. So these are the treatment. By using CT scan, we can find out based on the rupture, we can give treatment. Rupture severe means emergency condition. So we will do surgery. Less than 4 cm means don't operate, wait and watch. So last one, every year increasing in size 0.2 to 0.3 cm. Thanks for watching.